This week on Inside Olympia, from the halls of Congress to the Biden administration to Washington's Department of Social and Health Services, our guest this week was a major player in the federal government and is now helming Washington's largest state agency. We meet newly appointed DSHS Secretary Angela Ramirez.
From the TBW studio, it's Inside Olympia with host Austin Jenkins.
Welcome to Inside Olympia. We often see people move from the state stage to the federal stage. It's less often that the reverse happens. But our guest this week is one of the exceptions to the rule. She had a high-powered career in the other Washington, first on Capitol Hill, and then as a top agency official with the Biden administration. Now, this California native has returned to the West Coast to take on one of Washington's toughest jobs. Joining me now, and for the full hour this week, is the newly appointed Secretary of the Department of Social and Health Services, Angela Ramirez. Welcome to Inside Olympia. Welcome to Washington State.
Thank you for having me.
Position. Thanks for being here. We'll launch in just a moment, but first a little bit of background on you and your career. Here is some background on Secretary Ramirez and the agency she leads. First, Secretary Ramirez. Prior to her current role, she served as Chief of Staff and Deputy Chief of Staff in the U.S. Department of Health and Human Services under President Biden. Prior to that, she was a special assistant to the President in the Office of Legislative Affairs at the White House. Ramirez was also a senior staffer on the Biden-Harris transition team. Before her work with the Biden administration, Ramirez was Chief of Staff to Congressman Ben Ray Lujan of New Mexico, who rose to the role of Assistant Speaker. She was also Executive Director of the Congressional Hispanic Caucus, and Secretary Ramirez is a graduate of Princeton University and was named to Politico's 2019 Power List, where it was revealed that she started out her career pitching jokes to Comedy Central. We'll have to ask more about that. Now to the Department of Social and Health Services. It is Washington State's largest agency with more than 17,000 employees and a budget of $25 billion. It serves 2.5 million Washingtonians a year, or about a quarter of the state's population. Its programs include food, cash, and medical assistance, housing assistance, child support, vocational rehabilitation, adult care, mental health services, and disability support. Okay, well, that's a lot of background on you and the agency. Anything you want to correct for the record?
I think you got it all right.
Okay. Well, let's just start, because we haven't had a chance to talk with you before. You're brand new to this job, just 2 months into this role, and we'll have plenty of time to kind of dig into DSHS and your priorities. But it is unusual to see somebody come from the federal government, from a federal agency like HHS, to Washington State, to one of our state agencies. What prompted this move? What appealed to you about DSHS? Why did you apply? Why do you want the job?
You know, a lot of things came together to make this happen. I would say first and foremost is my love of the state. So when I was 18, I'll tell this story to date me a little bit. I was a huge Twin Peaks fan, and my brother and I convinced my parents to come up to Washington, and I fell in love with it. And in fact, when I was meeting the governor for the first time, I told them the story of writing in my journal as I was coming across on the ferry from Canada and trying so hard to put into words what it felt like to see the coast of the United States, to return home, what felt like home to me, even though I had never lived here. And I couldn't put it into words, and so I just wrote down, I guess I'll have to live here someday. A few decades go by. I got a little bit distracted by the work in D.C., but I've always loved coming here, whether it's the hiking and the camping and all of that, or just the feel of being in a place that is just been special to me since I was a teenager. That being said, I had a wonderful career in D.C. and had tons of levers that you can pull at the federal government, you know, trillions of dollars, 90,000 people at HHS, that sort of thing. But as you start to feel how the work, where it's going, you start to feel more and more, at least this was my experience, the power in the states. And not just states, but especially Washington. I told my team when I got there that their reputation preceded them, that I heard from people over and over again that Washington State was the best of the best of the best, had the best talent, innovation, the infrastructure you need to have an impact. And so I really wanted to be a part of the community here and also hopefully have an impact. And I would say, you know, best laid plans, I did have this whole theory of the case. You know, you put your laptop in a box January 20th at the precisely like 11:59 in the morning and seal it up. I had this moment of, well, what do I do next? And I had planned to take a little bit of a mini break. Then people find you. And when I found this position come my way, and they talked about being able to work in what had been told to me as the crown jewel of state government and a place I'd always wanted to live, I had to look at it. And I will say this kind of point that really pushed me to yes was when I heard the governor and the job description talk about the importance of collaboration. And, prior to that, as I was talking to them about it, I was like, oh, maybe this person should do it, or maybe this person kind of, as much the HR person, yeah. And then they read the job description to me, and I got some more information. When I saw collaborative leadership, that really sealed the deal for me.
Can you give us a little sort of background on your backstory?
Yeah.
Growing up in California, tell us a little bit about sort of your formative years and why you, and we are going to get to the story of your brief stint in the comedy world, but what led to a career in public service? And as you noted, you've spent almost a quarter century in D.C. Working in government. But what do you think it is about your upbringing in California that led to a career like this?
Yeah, I mean, it seems obvious to me now, but it's my parents. So my parents were both farm workers in the Central Valley in California. And if they were here today, they would say they accomplished what they accomplished, of course, because of hard work, of course, because of the communities they grew up in, and, a little bit of luck, all of those things. But they would also say government programs, public servants who set the bar that they could then clear and really laid a path for them to walk down. And when they managed to get their way through college, both of them, they're both in their 80s now, they became public servants because that's what they wanted to do. And I think they both had this idea that my brother and I might follow in their footsteps. So as you noted, I rebelled. I did when I went back east, became a comedy writer. It was my way of kind of elbowing them out of the picture just a little bit. But over time, what I found I kept coming back to was how to be of service to the public and my appreciation for government. So while they have their own personal story, what really drives me now is how can I, find the types of people, the types of programs they needed, and how can I apply that to the world we live in today? It's a very different world, of course, than the one they grew up in a long time ago, but a lot of the basic needs are still very relevant.
And I should note that you're not a stranger to state service. You actually started your career in public service in the California legislature. But before that, you do have to tell us the story of your brief stint in comedy and sort of the opportunity to send in some jokes to Comedy Central, it sounds like.
Yeah. So you show up in a new place, and this is maybe indicative of the moment I find myself in now. And you get to almost think about who you want to be and what you care about. And for me, it was, as I noted, a little bit of rebellion from the government work of my hometown of Sacramento, and the types of people that I wanted to work with who were just fun. And so
And again, this was at Princeton.
This was at Princeton. And so almost day one at Princeton, I wound up signing up for the comedy magazine and just threw myself into it and loved the people that I met there. And they were I think they were all men at that point, which was its own lesson in kind of working with people who have different sorts of experiences than you. But my favorite part was the writer's room. And I've never walked away from that. Well, I did walk away from comedy because perhaps I wasn't as funny as maybe some other people. I don't know. You can ask my team. Maybe when we're not on camera, they'll give you the real answer. But I loved that going into a room and I would have a joke or an idea. And I might think it was hilarious or perfect, or maybe I thought it was mediocre. But no matter where I was, it always got better by taking it into the writer's room, kicking around with my classmates, colleagues, and we would emerge and it would be better. It was like a magical process. And I love that almost more than the actual creating of the joke myself or the production of it at the end. I loved batting around an idea and making it better with a teammate.
Which gets back to your theme of collaboration.
Definitely. And I'm probably a sophomore, I think it was, when Comedy Central needed some writers. This is going way back in my memory bank. I think it was sophomore year. And they said it was right as The Daily Show. It was a predecessor to The Daily Show. And they needed some fake news headlines. So I wrote like 118 of them, and I think they bought 2 of them. And that was probably the greatest moment of my life up
That's
to that point.
not bad. They actually bought a couple jokes.
They did buy some, and it really launched me into, well, this is what I'm going to do with my life. But eventually public service came calling.
Okay. Well, it's great to get a little bit of the backstory here, and you've satisfied my curiosity, so thank you.
I'm glad you didn't ask me to be funny on camera, because that's usually what happens.
I'll hold back. Okay. But it's not a line in one's biography that I often see, at least in this context. So I was curious. Let's just try to compare HHS and DSHS, and this idea that you're working at the federal level, now you're at the state level. We think of DSHS as the largest state agency, but compared to HHS, so when you're coming in and looking at a new agency like this, you're thinking, no worries, it's a fraction of what I was dealing with in DC. Or how are you approaching it?
I would say worries. So the opposite of no worries. It's true. It's smaller in size, and in some ways smaller in scope. A lot of what HHS has, we have in different parts of the administration here. But there is something about living where you are working and where your work goes.
And delivering those services.
Exactly.
To the people in your backyard.
Exactly. And you feel, some of the most daunting moments at HHS, which didn't happen a lot. You're usually looking at $1 trillion, these huge numbers, where when you'd see a number like 1 or 3, how many kids are left in CBP custody as you're working to transfer them to an unaccompanied children bed, for example. And that's when you see the 1 or the 3 as opposed to the, $3 million, $100 billion, that's when you take that breath and think about the person, because there's an individual. On some level in the federal government, you're always thinking about people, right? That's what makes us public servants. But when you feel it, when you see that individual number, it really brings it down. And I will tell you, we went through federal shutdown, and all of my friends back on the Hill in DC were, working through how to unlock some funding for us. And when I was on the Hill for all those years, it's a hypothetical, right? Of course we care, and the folks that are doing this work, oftentimes they care very, very much. That's how you keep going. But then to have it translated over here, it was probably whatever that night was, the shutdown ended Wednesday or Thursday night. At the end, as we're kind of seeing where we're going, I went to the grocery store in Olympia, because I live here in Olympia, and I'm behind a woman with 3 kids, and she's got a cart, and I'm just a person in a grocery store, and she's a person in a grocery store, and I'm like, wow, she has a lot of food at 9 p.m. at night. And then at the end, she says, here's my card. I think it has SNAP benefits on it. And we all sort of took this moment together. She doesn't know who I am. I don't know who she is. The cashier is, almost holding his breath as the rain is pouring outside. Is the card going to work? And then it works, and she, goes out of the store with her groceries. We know those moments happen when you're at the federal government, but there's something really special and unique about seeing it and being a part of it here.
Well, on the topic of the shutdown, you started this position in September, and I would imagine you sort of want to spend those first few weeks and maybe even months at a place like DSHS getting up to speed, and then this crisis kind of falls on you. What was it like to sort of manage the government shutdown at the same time you were trying to get spun up on the job?
Well, I will say, best laid plans. So I show up, I had a whole theory of the case that you set up in your kitchen when you're like, oh, I'm going to do this job, here's the thing, I'll do this to it, et cetera, et cetera. The first crisis actually happened my first week. So Friday night, early morning of actually Saturday morning around 3 a.m., I get a phone call that there was an active shooter at Eastern Campus.
Oh, yeah.
And so you sort of jump out of bed and you're in it. And the whole plan of what I was going to do that Monday, week 2, you readjust. And it was, an awful way to see the eastern part of the state for the first time, an awful entrance in that facility for the first time.
And you lost one of your employees.
And we lost a colleague, Colleen,
a security officer.
Who seemed like she was a tremendous person, as you get to hear the stories about them. And but it is a reminder of the work that we do and what our colleagues at DSHS do, and put us into crisis mode right away. So within days. So by the time we got to shutdown, you know, you never get used to crisis, right? But by the time we got to shutdown, I had already seen what our team can do. I'd already seen them stand up, you know, not only wake up me in the middle of the night, which I'm sure was its own challenge of, you know, making sure the brand new person you barely know. And then you see incident command get stood up, you know, very, very quickly. You see the sort of muscle memory. You see the governor within hours on the phone with all these folks, and you kind of get the sense of what you're walking into, and that we do have to respond to crises. So to your question, by the time we got to shutdown, I won't say no one's ready for shutdown, right? No one anticipates all of the things, and I think the current administration at the federal level has put us through some pretty unique challenges. But I did have a lot of faith at that point in the team because I had seen them for a few weeks on what we might be able to accomplish.
The shutdown is over, but the challenges remain. In the news this week is the president sort of doubling down on the idea that blue states, Democratic states, are going to lose their SNAP benefits if they don't start to turn over information about SNAP beneficiaries, including their immigration status. I know there's ongoing litigation. You're probably limited in what you can say, but what are the chances that people in this state might have an interruption of those benefits because of this for a second time around?
So, as you noted, there is litigation, so I'm very limited in what I can say on this because I don't want to put anything at risk. But what I will say broadly on immigration, you know, we talk about it conceptually, but again, we're in the state. These are human lives, and we want to make sure we're servicing them as legally appropriate. And the other thing I will say, the thing that gives me great concern about things related to immigration and the immigrants here is this isn't even just about them, although surely that's worth some merit. It's also about the people that they serve. So 1/3 of caregivers are immigrants in Washington state. So when we start talking about what data might get shared or what chilling effect might happen in certain communities or what we want to put people through to get benefits, no matter where we're pointing this fire, it's going to hit the broader community because whether you're an immigrant or not, the chances are you're relying on their work. And we see it very directly in the direct care workforce, but we also see it countless ways in the state that are really important. So we're watching this really carefully. We're doing everything we can to stay on the right side of the law and make sure we're protecting the communities here in Washington.
I take it, though, that the position of this administration, the Ferguson administration, is that this is not information that the state is willing to turn over to the federal government.
I will defer to them on this. You know, I'm so leery about sharing anything because the stakes are so high in this and this is an active lawsuit. So I'll defer to them on that.
What is let me step back and ask you to help us, because you've had the benefit of working at the federal government at HHS and now you're at the state level. What is it? And there's been a lot of disruption. I mean, obviously the new administration came in and reversed course on a lot of things that the Biden administration prioritized and was doing. But what are you able to bring to this job at DSHS because of your knowledge of how the federal government and how HHS works? Yeah, I would say... And how Congress works.
Right. I would say that for starters, on the HHS side, there's a lot of understanding of bureaucracy and what's on the other side of the fence, so to speak. So understanding of everything from, you know, how dollars go out the door, sometimes the literal people who are looking at it, but certainly the systems that are typically followed. I would say a deep breadth of how the different departments in the federal government interact, and how we can maybe use that to maximize some of the things that we're trying to take on. And then just the understanding of the relationship between the feds and the states. So in Congress, for example, what information is helpful to an appropriator versus what information is helpful to someone on judiciary and that sort of thing? What do they want as much for their time in D.C. as they're working on lawmaking as they might when they come home and are serving their constituents?
Do you, what is your sense of this sort of time we are in? And, disruption is the word that comes to mind, but obviously there was the DOGE process at the beginning of the year. There are the policies, including the SNAP policy that we've just discussed. I imagine it must be somewhat distressing for you to see priorities that you and the leadership at HHS prioritized when you had control and power. Not much you can do about that right now. But how are you looking at and analyzing and taking this in?
I mean, the word I would use is unprecedented. I think there were a lot of norms across HHS, across the White House I was in, even across Capitol Hill when I was there in D.C. that are no longer followed. You look at SNAP and the Farm Bill, for example. It was bipartisan for as long as I was there. It never felt controversial. We could always understand that, of course, it's good for farmers, it's good for food banks, it's good for grocery stores. Yes, it's also good for people who need food. And we would move forward this on these issues in such a almost nonpartisan way, but certainly bipartisan. Other things related to career servants on, not exactly what I do in the public health space anymore, but you look at the deterioration of this ability to have these independent career civil servants who work for both sides of the aisle and then, are suddenly not part of the process anymore, and what that means. I think for us here in Washington State, the good news of this, because I'm always hunting for the silver lining, is that we have such tremendous resources here. A lot of the issues that came up at HHS were driven by this state, in part because they have a really tremendous congressional delegation and a tremendous state legislature and wonderful leadership here that knew how to find us and knew how to ask the right questions and put the right things on the table. And so my hope is that we can continue to build off of that talent, that history we have here, and find different ways in. But no question, I mean, you think about the shutdown, you think about the 5 different guidances we got on SNAP alone as we were trying very hard to maneuver around what they wanted us to do. I would say unprecedented.
And just one follow-up question on that point. The adversarial nature of the relationship between states, blue states at least, and this administration, the federal government, where does that leave you in terms of, is it constant unease? Does it feel like you are sort of in, this combat mode of every day is a fight? What is it?
I would say,
I
when you said every day is a fight, I went back to this idea I used to tell my team about. My dad boxed a little bit in college, and we were reminiscing over Thanksgiving about how when you fight, you can't fight angry. You can be angry, you can be frustrated, but when you're in the arena, when you're in the ring, you have to be calm and focused and not angry. So I try very hard, most of the time I am successful, to see these as inputs and to be strategic. And to work with my incredible team about, okay, we got guidance A on a Monday, and it's now changed by Tuesday, Wednesday. How are we going to be strategic? Is it heartbreaking to think about the things that are no longer there, about the strides we made coming out of COVID? Of course, these are not good feelings when I think about that mom with her 3 kids who had her shopping cart and just wanted to get the food that she was entitled to. It's not a thing I want to recreate on a daily basis. But look, we are in unprecedented times. These are really, really hard times, and the only way forward is through. So what I keep telling myself, it's less about being in a fight moment to moment. It's more about we have to put our best team together, our best foot forward, and we have to find a way through.
Obviously, there's been a lot of it reacting kind of in the moment and fires to put out. But bigger picture, what are your priorities coming in? What are the governor's priorities for this agency? When you can sort of blue sky this and think at a higher level, what's your mission here?
Yeah, so, I was very intentional when I took this job that I didn't want to come in with very specific priorities. I learned in a bureaucracy like HHS that, I could come in and wave a wand, but and say, please do this. And maybe people would do it. But to really make lasting change, I had to understand the system. I had to understand the history of it. I had to understand the culture and the team. So I told the team, the senior leadership at the beginning, that I really wanted to take some amount of time to learn what they were doing and build off of the good work that they were doing. Again, I think if I had found an operation that wasn't working in any level, maybe I would have come in a little bit stronger with certain priorities. But what I knew I was inheriting was actually a lot of tremendous talent that really, their heart is not only in the right place, but they have the baseline skills to do a lot of great work. And instead, the challenges were going to be in reacting to things like the federal government shutdown, for example. So instead, what I did was look at the governor's priorities. Again, priorities that really drove me to want to take this job and do this work. So we talked a little bit about collaboration, but I would also say the customer experience. So if I had one sort of true north that you find me at right now, it's how do we make government, and specifically DSHS, work for Washingtonians, for the people that it serves? How can we find more efficiencies? How can we make it more consumer-facing and friendly for your average Washingtonian, just trying to figure out the type of work that we do and how they can be a part of it potentially. Now, find me after legislative session. I think I really want to go in. I mean, 20 years in D.C. in the House, I know what a legislature can do in terms of having really important critical opinions to change some of where we're going, and I take that very seriously, and I really want to hear and learn from them. I potentially will have a slightly different answer on the backside of session, but right now I'm focused on the governor's priorities and especially on the customer experience.
And just before we go to break, I mean, the state is facing budget challenges. The agency has already had cuts, I believe had layoffs. This is a supplemental year. Have you thought about sort of what, and obviously every agency has their asks, but kind of how you're going to approach this as the new secretary and also in a budget deficit situation?
Yeah, I mean, a really, really tough situation to walk into, right? And this is where I'm not going to only rely on my team, but on the experts in the legislature, on the experts on the governor's team, and my colleagues across the Ferguson administration. I think the types of asks we're putting forward, of course, have the budget in mind. And I think what will be really interesting is if we can use some of this hardship as an opportunity. So some of these examples on, for example, technology, and we've made some strides in years past. How can we leverage some of that to take some of these really challenging times and turn them into opportunities?
Well, on that note, let's take a quick break. When we return, we'll continue our in-depth interview with DSHS Secretary Angela Ramirez, back right after this.
Stolen vehicles are a problem. We need a solution. Pursuits are not the solution to that.
Washington State is not missing high-speed police pursuits. Washington State is missing the possibility of a high-speed pursuit.
Welcome back to Inside Olympia. Joining me once again is Department of Social and Health Services Secretary Angela Ramirez. And I want to ask you about the impacts. We'll stick with this theme of the federal government making decisions and how that impacts the states. H.R. 1, the president's big, beautiful bill, has lots of implications for the delivery of human services in states. As you and some of this affects other state agencies more than DSHS, but where do you see the biggest effects for DSHS and the clients it serves?
Yeah, I mean, the one that jumps to mind is work requirements, right? And I know, as you noted, we're working really closely with our partners throughout the Ferguson administration on this. But work requirements, on the one hand, it sounds so innocuous on paper. Why not have a work requirement? But to set up a system, again, this is a bureaucracy. These are people's lives going through this bureaucracy. It is not an easy lift. It is a very difficult thing, from technology to legal to outreach, and the timeframes are really crunched, and then the stakes are really high when you talk about the error rate. We're heading into hundreds of millions of dollars. So,
because the state will be penalized if not in compliance.
Right. And while we, silver lining again, Washington State is at the top of the heap when it comes to error rate. The state, long before I got here, has had a lot of success in keeping the error rate low and being good stewards of the taxpayer dollar. But the reality is they're asking for more without giving us additional resources. And one thing I will highlight, we think of HR 1, or sometimes folks do, as its own thing in a box, right? You take a vote on HR1 and then it goes to the states and it becomes law, et cetera, et cetera. But these are employees at DSHS who are working to implement it. And they still have other jobs. It's not like we hired a bunch of people to work on HR1. For example, we have a tech team, and they are working on implementing HR1 requirements as it relates to technology around work requirements. Very busy job, very high stakes, again, unprecedented questions coming their way. Meanwhile, October comes around and we're in shutdown. And we start getting questions from the feds about how can we change our SNAP benefit rates. And they keep changing, numbers are changing. Those same people on that same team, whether it's the tech people that are trying to implement HR1 or some of our policy experts, those same people are now put on this very quick turn, sometimes day-to-day turn on getting information to the feds around SNAP benefits and implementing new things. So, if it were just HR1, I won't say I feel confident about it. Let's be honest, this is a huge challenge. But what makes this all the more complicated is the fact that we're not given more resources to do it, and that the same people are being tasked with more across the board from the feds.
I believe that roughly 1 million Washingtonians are served through the SNAP program. Remind us, in HR1, are the work benefits applicable both to Medicaid and to SNAP?
Yeah, so we're focused on the SNAP piece in
because
part.
HCA, the Healthcare Authority, has Medicaid.
Right, but there's definitely a lot of overlap, and working through a hub there with our colleagues at HCA.
There's also, sort of smaller but impactful elements of this bill, the shuttering of the heat and eat program, for instance, which I understand would affect about 75,000 households. How does that work currently, and it's going away?
Right. So LIHEAP, these are programs, again, from my time in Congress, have never been partisan, have never been on the table. I mean, this is about whether you have heat when it's cold enough to freeze to death, or cooling when it's hot enough.
So these are SNAP beneficiaries who are also getting funds to pay their heating bills.
So this is, and in fact, not necessarily SNAP beneficiaries. So one of the things that I like to talk about when I'm talking with the team is how, a SNAP beneficiary doesn't wake up exclusively as a SNAP beneficiary. They might wake up as a member of a tribe, or a rural Washingtonian, or someone that also needs housing, or someone that also needs heating. And so they might be beneficiaries of these different programs. So a lot of what we're trying to do is do this customer-facing effort, again, much harder than perhaps it sounds, to make sure we're meeting them where they are and finding these crosscuts to get them these services.
There are also biennial eligibility checks that are going to be required,
Yep.
Citizenship and residency verifications, changes to long-term care eligibility, the family planning clinic moratorium that affects it's on the Medicaid side, nutrition education funding elimination. As you kind of go down this list, you sort of gave the example of having to, for instance, do the work verifications.
Right.
But how are all of these mandates stacking up? And what do they present for this agency, for the staff, and ultimately for the beneficiaries?
I mean, a great challenge we have to navigate. We don't have an option, right? Again, if we could have the best SNAP program in the world, but if someone needs housing, they need housing, and they might need both at the same time. And the fact that the feds are layering all these requirements on us without providing additional supports, it compounds. And, we don't have a choice. We have to find a way through this, but it's going to be very, very hard. And I think, you hit on different communities. There's so much intersect in these communities, and some of the hardest hit people are going to be the most vulnerable. And while we can put the most vulnerable in a box, as I noted, for example, with the immigrant community, ultimately, those folks are serving us in other ways, whether it's caregivers, whether it's other spaces in the workforce. We talk a lot about the aging in the state and the need for supporting our direct care workforce. Frequently, those are folks who are going to need some of these programs, and these are not easy jobs. These are skilled jobs that we want people to be healthy, happy, fed, housed when they're doing this important work. So, it not only compounds on the individual and on us as a bureaucracy, as a system, but it compounds on the entire community that folks are being served by.
I know we've seen on the Medicaid side estimates about how many people in this state are likely to lose Medicaid coverage. Have you been able, or your staff been able to calculate, for instance, on the SNAP side or other lines of benefits that DSHS provides, how many people might be kicked off?
Yeah, we have a lot of data, and I'm happy to surface. We are never for lack of data at DSHS, I will say that, and the impacts on different communities. And we've broken it down. A lot of times we break it down by community. So, immigrant impact on the immigrant community, impact on the rural community, impact on tribes. It runs across the board. But what I'll really highlight when it comes to the data is the thing that we don't know, the part that truly keeps me up at night on this is what's going to change. Like we saw with SNAP, we can do the best job in the world on calculating SNAP benefits and figuring out who's going to be kicked off. But if then the next day they tell us put this at 65% instead of 100%, that changes the calculation. So I think, we can do data, no question. There are limited resources and we only have so many people, but I am confident in our ability to figure out a number. Where it gets really hard is when the goalposts change and when that changes so frequently. And
to go back to the point you made a few minutes ago, if you don't comply to the letter of the law, the penalty can be in the hundreds of millions of dollars.
Correct.
Which is probably not money that's just lying around.
It's not lying around, and it's the sort of number, that would keep me up at night at the federal level. So the fact that this is on the state level gives us a lot of pause. And I think, again, if we were playing on the playing field that we understand on day one of, okay, HR 1 implement, and we didn't also have to deal with shutdown and with all these other requirements that come our way, I'd have some degree of confidence that we could create a plan. It's really the freneticism, the sort of lack of a plan that we sometimes have to
Remind us
deal
of
with.
the time frame and the deadlines here.
Yeah, so once we get into the spring, we'll do these reviews, and they will. We have the ability to pivot depending on what the error rates are. I can get you, it's this very specific time frame. By 2027 is when we would potentially be facing kind of the steepest cliff, but there's a whole, moment to moment where people go through that we're tracking. But outside of the timeframes, what I will really emphasize is it's happening this very second. So while we have our own internal markers and the 2027 date, the reality is these things take so much time to implement. So the deadlines that are in my head are right this second. How do we get our error rate down now? How do we get the word out to people who may need to be ready for work requirements now?
You have sort of this extended pre-implementation period, but it's also a time period when you have to communicate with people who could be affected. Right. You need to get sort of the agency's ducks in a row.
Right.
Need to set up these systems. So this is obviously, the policy of the Congress. This bill was passed and signed. You may disagree with elements or a lot of it, but now you have to implement it. Are there ways to soften the impacts? Are there ways to say, look, if you were serving in a red state, you might be embracing this and saying, look, these are long overdue changes. We're happy to implement them. We think there need to be a higher bar for some of these benefits. If people aren't complying, sorry, you're off the system. That would be a very different conversation if we were sitting in Texas, for instance. Is there a way to manage through this kind of from a glass half full standpoint, or to soften the blow?
I mean, that's the opportunity, right? Although I will say what's interesting is you are seeing a lot of states, regardless
of the
politics. I mean, federal funds are federal funds and requirements are requirements. And yes, some states might take the perspective of this is good if we can kick some people off and limit, for example, on Medicaid, limit this. But what we saw when I was in the Biden administration was many states wanted, for example, the funding to expand Medicaid. because it's funding. And at the end of the day, folks are going to be on their streets or in their ERs or in their facilities. And if the feds are going to pay some of this, you want to expand Medicaid. It was kind of a no-brainer for most states. So where my head goes on this is less about the partisanness of it, but more about, okay, everyone wants to be a good steward of the dollar. And I think Washington State has long shown that they are quite effective, actually, in keeping, for example, error rates low. I think now, in terms of softening the blow, it's more about where are these corners of opportunity we can find to make things, whether it's more efficient and consumer friendly or customer facing type of language that we're using, whether we can use technology or new ways to get to people who might be in more hard to reach parts of the state. We don't have $1 billion budget to go out and do a bunch of commercials on television. Yeah. We have microphone and your time. How are we using our own bully pulpit to make sure people know about the types of work that we're doing? Are there new ways to leverage our relationships with community organizers and partners in the field? Are there new ways to leverage the information coming from the legislators, who are oftentimes the people that get the information first? And we've done it before. We've done things like collaborate on MyWA benefits, working across the Ferguson administration to implement interesting ways to get at information with our friends, for example, at WATEC. So we want more of that. Can we work with our community colleges? Can we work with folks in the field to get people ready? So this what is a tremendous burden. I don't want to say it's not a burden, but it could perhaps be an opportunity.
Just for a little bit of context before we move on, what would you say if you're looking at a pie chart of how you and your staff are having to apportion their time right now?
Yeah.
Where does compliance with HR 1, how much of the pie is that taking up right now? Is that
That's
20%?
A great question.
Is it 40%? Just help us.
It's a great question. I would say, it's almost like, I will say that in the same way of True Blood, it's almost like the playing field we're on some days. So I don't usually think of, just like I'll say our clients, I don't think of the people that we serve as like they are a SNAP beneficiary or they are a member of a tribe or they are a rural Washingtonian. I think of them as someone that's coming to our website or someone that's taking part in some of our programs. I would say the same for our time. It's less about, from X hour in the morning to this hour, I'm on HR 1. It's more that it collides into so many things, whether it's, our shutdown realities, whether it's how we're staffing up, whether it's some of our legal conversations. It's kind of all consuming. These are really like large playing fields that we're playing on.
You mentioned True Blood. That's a nice entree into talking about mental health services. True Blood, of course, was the lawsuit that had to do with people who were languishing in jail, not getting the services they needed in state psychiatric hospitals. The state has invested a lot of money, billions of dollars, in trying to shore up the behavioral health system. The governor was just out at Western State Hospital working for a week and getting to know folks and see that operation up close. Of course, the new forensic hospital of excellence is being built as we speak. That's going to put, 350 beds online by 2028?
2028.
So,
on time and on budget, by the way.
So what is you've got the two state hospitals, you've got this history and legacy of the state not having the capacity it needs.
Right.
You also have projections that show, I think, 8% growth year over year in bed needs.
Yes.
So you're getting your head around things. And by the way, on the True Blood side, it sounds like you're compliant right now. You're getting people into the hospital for evaluation and then into a bed if they need it within the court's timeframes. Am I correct about that?
Correct.
But it may be tenuous too. It's today. So how are you just starting to think about this pretty fragile system?
Yeah. Well,
and the individuals, to go back to your point, that
right.
There's very vulnerable individuals who are dependent on it.
Right. Well, first I'll say, I use the word playing field. It's driving policy, right? I think about True Blood every day, whether it is directly or indirectly, because when you talk about $100 million, when you talk about constitutional rights,
these are the fines that that can accrue, and you've got a court mandate.
Right. The dollars are real, the constitutional rights are real, the people are real. We take this really seriously, and Interestingly enough, I talked about how Washington State often crossed my desk at HHS. This was one of the topics that percolated up at
Is
my
that
desk.
right?
It did, in part because of the tremendous leadership here, making sure HHS was aware of it and trying to find ways through. So I was aware of the impact of this case long before I ever considered coming here or taking this position. So on the one hand, I feel very steeped in it. I think about it all the time. I worked on it, or at least was aware of it and briefed on it a couple of times at HHS. On the other hand, I'm 2 months in, and there's so much to learn on how to make sure we are seeing our obligations through. I will say, as you noted, we're in compliance, and we've been in compliance for almost 2 years. So I don't want to get too hopeful about anything, but I think we have a really good recent track record of making sure that we're on the right side of the law and the right side of the folks involved with True Blood. Where do we go from here? As you noted, bed capacity is a challenge, but
And there's a bed. You need beds for forensic patients, and you need beds for civil patients. And they were trying to move the civil patients out into the community.
Correct.
To make room for the forensic patients at the state hospitals.
Right. And there were elements of these types of work that I did at HHS, so I'm very familiar, again, when you're thinking of like these individuals and how you move them. They're not widgets, right? They're people. So it feels
Very complex needs.
right. Human beings with very complex needs that have changing needs. It's a fluid situation, and there is a bright line about staying on the right side of the law on this. With again, huge fines on the other side. But what I will say is, it's not enough to build beds and build capacity. We have to look at this holistically. And if HHS taught me anything, is that you can play the game of build the bed, do the thing, and that is an important space to be in. Don't get me wrong. We need the resources to address this. But the real way through, the longer term solution is to treat the patient holistically and to weave in social services into the justice-involved community and the judiciary, so that as we are working through these patients and the very real, very needed bed transfer, we're finding other ways to find efficiencies.
You can also build facilities and have trouble staffing them. Can you speak a little bit to the work for what you're hearing and being introduced to in terms of workforce challenges in DSHS generally, but especially in the behavioral health space?
Yeah, I appreciate that question. So at HHS, just a little bit of background too, this was an issue I worked on for a few years. I co-chaired and founded the HHS Workforce Initiative alongside the head of HRSA. And I did that because I saw the impact of health workforce, including behavioral health workforce, on our communities, on our larger policy systems. It was nonpartisan, it's rural, it's urban, it's everything. Whether you are, in the disability community and need home care, whether you are someone and want care in a hospital, the world needs all of us, right? And we do not have enough docs, nurses, pharmacists, long-term caregivers, but also folks that maybe aren't always, on the TV, not just the ER excitement of the various shows, also about folks like ASL translators. We have a huge dearth of those folks. So the world needs all kinds. And what I saw at HHS was the way to do that is to break down these silos and take workforce as a holistic problem. One of the things I did there that I was really proud of, that I hope to recreate in some capacity, was a website design. And we created this website at HHS where an individual could go and find out about information, whether it was, if you wanted to be a doc, you could previously go to SAMHSA and learn about their supports. You could go to HRSA, you could go to FDA, even and CDC. Across the board, there were different types of things people could go to find workforce information. We compiled it and put it on a website that lived on a corner of HHS, and then Secretary Kennedy took the website and put it on his landing page, a show of support for an issue about how nonpartisan and critical workforce is. So that brings me here today to Washington State. It is how we're going to get through this crisis is through people. But let me be clear, we don't just need more people in these jobs. We need them to be good jobs, because we can recruit ourselves to the hilt, but if they don't stay because they don't feel safe or they don't feel supported or they don't have the training they need to do the work they want to do, we're going to lose them. And so what I'm really focused on is whether it's the behavioral health space or an ASL translator, how are we making these into jobs that people want to stay in, where they see a way to either career ladder up if it's something they don't want to stay in, or perhaps dedicate their careers to it.
I want to ask you, and we just have a couple of minutes left, but so there's the institutions that the state oversees. Another one is the Special Commitment Center on McNeil Island. I realize it's probably too soon for you to have gotten out there, but it's been in the news in recent months under criticism for the level of therapy that's happening, questions about the oversight. There's been some leadership changes there. What are you hearing about that facility, and what is your goal in terms of steering it in the future?
Well, obviously a really complex set of facts and people, right? And we talk about meeting people where they are. This is a really unique challenge, and in that space.
And it's unique geographically because it's on an island.
I was going to say both physically and figuratively and literally. The thing that's always top of mind to me is how do you make sure everyone who needs to have information has the information? How do you make sure that we're just really crystal clear on where the lines are, so that what needs to be shared with the public, where do we need to make sure people have points of entry into this space, while still staying on the right side of the law of protecting privacy, of making this as workable as possible. It's I'm in 2 months. Yeah. I haven't gotten there yet, as you noted. I think I have a lot to learn there, but that's what my true north is how do we make sure we are very aware of where the bright lines are, particularly with McNeil Island.
There are obviously challenges running institutions, but we're also a state that's really tried to treat and serve people in the community, and that is true of mental health patients, but also of clients in the Developmental Disabilities Administration. And yet services and care can really falter there too. Yes, they're out in the community, but there may be fewer eyes on them. We're contracting out those services. So just sort of a big picture global piece. How do you see DSHS, and what can you do in this leadership role to ensure that people are protected, whether they're in an institution or in the community?
Yeah, thank you for bringing that up. I mean, look, most people, if you talk to them, want care in their home, right? They don't typically want to go to a facility. Now, it is important. There are people who prefer to go to a facility, and that is something I know we're working through, and I know we've heard from the legislature and others in the community who have really strong opinions on this. But we can't turn a blind eye to the need to provide services in the home. There are a lot of complications providing services in the home. A lot of times, how are you training people? How are you paying for them? When I was at HHS, we really tried to lean into flexibility on supports for folks, but it's something we can't lose sight of, because you get the data points constantly on the facilities that we run, and there's an obvious point of entry there for us to talk about them. When folks go into the home, frequently their caregivers are family members and historically might not have been paid for the work, and need things like child care supports or transportation supports or elder care supports to make these jobs palatable, and to help support people in their home. We can't lose sight of that.
Just a minute left. What is your message to the 17,000 or so employees of DSHS? You can't be over every one of their shoulders. You can't supervise them individually. There's a lot of trust in the work that they do. When you think about your North Stars and what you want your staff to be doing every day when they show up, what is it?
Well, I appreciate that question too. I'm trying to do. I wish I could put them all in a room and look them in the eye.
Yeah, they do that at the State Department, but I don't.
I'm not going to do that.
People, I don't know
Definitely
if you can
not going to do that. On our limitations, apparently, even getting everyone into one Zoom together or one Teams meeting is too much. So what I am doing, and what I hope for those who are able to join us when I do our all hands meeting, I'm going administration by administration and meeting them and really expressing my gratitude. I think if I had one true north, why am I in this location? Why did I take this job? Of course I love the state. Of course I'm excited to work in state government, but it's because of them. It's because of the reputation that they put on the table when I was back in DC. I've been so impressed every time I get to be in a room with one of them, whether it's the tech folks, whether it's the subject matter experts, whether it was Incident Command at Eastern or the folks at Western, or the engagement in the community, the folks that go out into the field. They're just the most incredible group of public servants. I want to do right by them.
Okay, I got to stop you there.
Okay.
Angela Ramirez, Department of Social and Health Services new secretary. Thanks for coming in to do this, especially just 2 months into the job.
Thanks for having me.
We'll do it again. And thank you for watching Inside Olympia. We'll see you again next week.